I begin this investigation in silence, almost like someone observing something too small to be taken seriously, too easy to dismiss, too subtle to feel urgent, because that's exactly how it starts. A slight discomfort when brushing your teeth, an occasional bleed that you wipe away and forget, a strange sensation when you run your tongue along the gum line, like something has shifted, but you can't quite put it into words. A tooth that feels just a little more exposed than it used to. A sensitivity that wasn't there 6 months ago. And right there, in that quiet, almost invisible space, is where the danger lives. For a long time, I believed what most people believe, that gum recession was simply a natural part of aging, that after 50, your gums were going to pull back no matter what, that it was inevitable, genetic, something that just happens, like gray hair or reading glasses. But the deeper I went into this topic, the more I realized something unsettling. The belief isn't just wrong, it's dangerous, because it stops people from acting. It turns a treatable, even reversible condition into something that silently progresses for years, while the person waits for it to become someone else's problem. The truth, the real truth, is that your gums don't recede overnight. They give you warnings, silent, progressive, almost invisible warnings. And most people miss every single one of them. Part 1. The signals you're probably ignoring right now. Let's start with the one that surprises people the most. The first sign of gum disease is usually not pain. It's not visible recession. It's not a loose tooth or a swollen gum or any of the dramatic symptoms you might expect. The first sign, the one that shows up earliest, the one that most people overlook completely, is persistent bad breath. Not the kind that comes from eating garlic or waking up in the morning. Not the kind that a mint can fix or that disappears after you brush. I'm talking about the kind that comes back quickly, the kind that insists, the kind that's there when you leave the house in the morning and still there when you get home at night, the kind that makes you self-conscious, that you've maybe started to accept as just a part of who you are. That bad breath is trying to tell you something. Here's what's actually happening beneath the surface. Before gum recession becomes visible to the naked eye, there's already an inflammatory process in motion. Bacteria have started to accumulate along the gum line, organizing themselves into what's known as dental plaque, a soft, sticky, colorless film that coats your teeth and gums. This plaque, if not removed consistently and correctly, begins to harden within 24 to 72 hours. It mineralizes, it calcifies, and it transforms into something far more stubborn, tartar, also called calculus. And once tartar forms, your toothbrush can't touch it. It has to be removed professionally because it adheres to the surface of the tooth with a grip that no amount of brushing or flossing can break. And while it sits there, sometimes for months, sometimes for years, it creates the perfect environment for pathogenic bacteria to thrive. Those bacteria release toxins, your immune system responds, your body sends inflammatory signals to the gum tissue. And the gums, swollen, irritated, and under attack, begin to behave differently. They bleed more easily. They look slightly redder than usual, or slightly paler, depending on the severity. They may feel tender when you press them, and they begin, slowly and imperceptibly, to pull back. The bad breath you've been dismissing, that's the byproduct of billions of bacteria metabolizing proteins and producing volatile sulfur compounds. The same compounds that make your mouth smell like something decaying. Because in a very real sense, something is. The tissue is inflamed. The bacterial ecosystem is out of balance, and the odor is your body's way of broadcasting that imbalance to the world. This is why persistent bad breath should never be brushed off. No pun intended. It's not a hygiene problem. It's not a sign that you need a stronger mouthwash. It's a symptom a warning, a biological alarm bell that something in your oral environment has shifted in a direction that needs attention. But most people don't connect those dots. They reach for the mouthwash, they pop another mint, they brush harder, and then they wonder why nothing seems to change. Part 2. The brushing mistake that's making everything worse. Let's talk about brushing, because this is where I need to challenge something that most people take for granted. You've been brushing your teeth your entire life. You probably feel confident about it. You probably think you're doing it right. In fact, the very idea that you might be brushing incorrectly after decades of practice probably sounds a little absurd. But here's what the research consistently shows. Most adults are not brushing correctly. And the mistakes they're making aren't just ineffective, they're actively damaging. The most common error isn't brushing too little, it's brushing too aggressively. Horizontal scrubbing. Back and forth. Back and forth. The way most of us were taught as children. Hard bristles that you choose because they seem like they'll clean better. Pressure that you apply because it feels more thorough. And all of this repeated twice a day, every day, 365 days a year, for decades. What does that look like over time? It looks like gum recession. The gum tissue is not built to withstand repetitive mechanical trauma. It's delicate. It's vascular. And it responds to aggressive brushing the way soft earth responds to a constant stream of water. It erodes. Not dramatically, not all at once, but consistently, progressively, millimeter by millimeter. You don't feel it happening. There's no pain in the early stages. There's no visible change from one week to the next. But over months and years, the erosion accumulates, and one day you look in the mirror and your teeth look longer than they used to. Or you take a sip of cold water and feel a sharp, sudden sensitivity that wasn't there a year ago. Or your dentist holds up the mirror and shows you something you weren't expecting, that your gum line has pulled back, and the root of the tooth, the part that was never meant to be exposed, is now visible. That's abrasion-induced recession, and it's far more common than most people realize, particularly in individuals who are diligent brushers. Because diligent brushers tend to brush harder. There's a painful irony in that. The people who care most about their dental hygiene, who brush after every meal, who use firm brushes because they want a deep clean, these are often the very people who are accelerating their own gum recession without knowing it. So what's the right approach? The evidence-based technique recommended by periodontists, dental specialists who focus specifically on gum health, is called the modified base technique. It involves holding the toothbrush at a 45-degree angle to the gum line, using small, gentle, circular or vibrating motions rather than horizontal strokes, and allowing the bristles to sweep just slightly beneath the edge of the gum. This technique is designed to clean the sulcus, the tiny groove between your tooth and your gum where bacteria most love to hide. It requires a soft, bristled brush. Not medium, not firm, soft. It requires light pressure. If you press so hard that the bristles splay out, you're pressing too hard. It requires time. Not 30 seconds of furious scrubbing, but 2 to 3 full minutes of deliberate, attentive movement across every surface of every tooth. And it requires awareness, a level of mindfulness about what you're actually doing that most of us never apply to this routine that we've been running on autopilot since childhood. Think about that for a moment. You've been brushing your teeth for most of your life. How much conscious thought have you devoted to the technique? How often have you paused to consider whether what you're doing is helping or hurting? Most of us learned how to brush before we were old enough to understand why any of it mattered. And we've never revisited that knowledge since. That's not a moral failing. That's just how habits work. But habits can be changed. And changing this one, just this one, could make a measurable difference in the health of your gums over the next year. Part 3. The two-stage progression you need to understand. Now I want to walk you through something that every dentist knows, but most patients don't fully grasp. the way gum disease progresses in stages and why the distinction between those stages matters enormously. Stage 1 is called gingivitis. Gingivitis is inflammation of the gingiva, the gum tissue. It's caused by the bacterial buildup we talked about earlier, plaque that isn't adequately removed, toxins that trigger an immune response, and the resulting inflammation that makes your gums red, puffy, and prone to bleeding. Here's the most important thing you need to know about gingivitis. It is fully reversible. If you catch it here, if you clean up your technique, improve your routine, see a dental hygienist for a professional cleaning, the gum tissue can return to its healthy state. There's no permanent damage at this stage. The tissue hasn't been structurally compromised, the bone hasn't been touched. This is the window, this is where intervention has its highest possible return. But gingivitis is sneaky because it doesn't always hurt. Sometimes it doesn't hurt at all, and so people see a little blood when they brush and think, well, that happens, and move on. They don't recognize the bleeding as an alarm. They don't make the connection between that light pink tinge in the sink and a bacterial infection in their mouth that, if left unaddressed, will advance. And when it advances, it becomes periodontitis. Periodontitis is not just more severe gingivitis, it's a qualitatively different disease. The inflammation has now moved beyond the surface tissue and begun to affect the underlying structures, the periodontal ligament, which connects the tooth to the bone, and the alveolar bone itself, which is the bone in your jaw that holds your teeth in place. As periodontitis progresses, the bacteria work their way deeper. They colonize the space between the tooth and the gum, a space called the periodontal pocket, and attack the structures that hold the tooth in place. The body, in trying to fight the infection, begins to break down bone and tissue. This is called bone loss, and it's irreversible. Once that bone is gone, it does not grow back on its own. The consequences of advanced periodontitis are severe. Teeth become mobile. They shift, they wobble, they move in ways teeth should never move. The gum line recedes dramatically, leaving long stretches of root exposed, vulnerable to decay in an area where enamel doesn't exist to protect them. And ultimately, without structural support, teeth are lost, not because they decayed from the crown down, but because the foundation beneath them was quietly destroyed. This is a disease that takes years to reach that point. But it reaches that point far more often than most people realize. Studies suggest that over 47% of adults over the age of 30 have some form of periodontal disease. Among adults over 65, that number rises to over 70%. That's not a rare condition, that's the majority. And most of them either don't know it, or they know something is off but haven't connected the dots yet. You might be one of them. If you've noticed bleeding when you brush, even occasionally, if you've had persistent bad breath that won't go away, if your teeth look longer than they used to, or if you felt increased sensitivity to temperature, if any of this resonates, and these are not coincidences, these are the signs of a process that is already underway. The question is, at what stage are you? Part 4. What's really happening in your mouth? The microbiome perspective. I want to take a step back from the clinical language for a moment and talk about something that fundamentally changed the way I understand gum disease. Your mouth is not supposed to be sterile. In fact, a healthy mouth contains hundreds of species of bacteria, a complex, balanced ecosystem called the oral microbiome. Most of these bacteria are harmless or even beneficial. They outcompete harmful pathogens. They maintain the chemical balance of your saliva. They play a role in digestion. They're not the enemy. The enemy is dysbiosis, an imbalance in that ecosystem where pathogenic, disease-causing bacteria begin to outnumber and outcompete the beneficial ones. And here's where it gets interesting. The conditions that allow pathogenic bacteria to thrive in the mouth are largely conditions we create through our own habits. Inadequate cleaning allows plaque to accumulate and harden. A diet high in sugar and refined carbohydrates gives harmful bacteria exactly the fuel they need to multiply. Dehydration reduces saliva production, and saliva is one of the mouth's primary natural defenses. It neutralizes acids, washes away debris, and contains antimicrobial compounds that help keep the bacterial population in check. Smoking profoundly disrupts the microbiome and simultaneously suppresses the immune response, creating a perfect storm for periodontal disease. Even stress plays a role. Chronic psychological stress elevates cortisol levels, suppresses immune function, and has been directly linked in research to increased rates of gum disease progression. This is one of the reasons why adults over 50 who may be carrying accumulated stress, taking medications that cause dry mouth, and dealing with hormonal changes that affect tissue health are disproportionately affected. But the flip side of all this is hopeful. If we created the conditions that allowed the dysbiosis to develop, then we can also create the conditions that allow the microbiome to rebalance. Not overnight, not with a single product or a single habit change, but with a consistent, informed, multi-front approach that addresses the real drivers of the imbalance. The microbiome responds. Research in periodontal microbiology has shown that targeted improvements in oral hygiene, combined with professional intervention when necessary, can significantly shift the bacterial composition of periodontal pockets within weeks. The pathogenic species that were dominant begin to lose ground. The beneficial species that were suppressed begin to re-establish themselves. The gum tissue, relieved of the constant bacterial assault, begins to heal. This is why so many people see relatively quick improvements in their gum health once they commit to the right approach. It's not magic, it's biology. The system wants to be in balance. It just needs the right conditions to get there. Part 5. The role of flossing and why you're probably not doing it right. Either I know. You've heard it 1,000 times. Floss more. Floss every day. Floss, floss, floss. And most people either tune it out or feel vaguely guilty about not doing it and move on. But I want to reframe this conversation because it's almost always about frequency, how often you floss, when the more important issue is actually technique. A toothbrush, no matter how good your method, cannot clean the interproximal surfaces of your teeth. The interproximal surfaces are the sides, the faces of the tooth that press against neighboring teeth. These surfaces account for roughly 40% of each tooth's total surface area. They're warm, moist, sheltered from saliva flow, and unreachable by any brushing motion. They're paradise for bacteria. Without flossing or an equivalent interdental cleaning tool, these surfaces never get properly cleaned. The plaque accumulates undisturbed. The tartar forms. The inflammation begins specifically at the papillae, the little triangular peaks of gum tissue that fit between each tooth. And because the spaces between teeth are often the first places where periodontal pockets develop and deepen, neglecting interproximal cleaning is effectively leaving the most vulnerable areas of your gums completely unprotected. Now about technique. Most people who do floss snap it down hard between teeth, scrape back and forth a few times, and move on. This misses almost everything that matters. The correct technique involves curving the floss into a C shape around each tooth, sliding it gently just beneath the gum line into the sulcus, and moving it up and down the surface of the tooth in a gentle scraping motion. You do this on both sides of every gap, the surface of one tooth, then the surface of the adjacent tooth. If you've never done this before, your gums will likely bleed the first several times. This is not a reason to stop. It's evidence that inflammation was already there, and it confirms that you were right to start. With consistent, correct flossing, most people see the bleeding reduce significantly within 2 to 3 weeks as the inflammation resolves. For individuals who find traditional floss difficult, whether due to dexterity issues, tight contacts between teeth, or dental work like bridges, interdental brushes, water flossers, and floss picks can be effective alternatives. The goal is consistent, thorough interproximal cleaning by whatever means works best for you. Part 6. What happens after 50 and why the stakes get higher? I want to speak specifically to those in the over 50 demographic, because gum health after 50 deserves its own chapter. As we age, a confluence of factors can accelerate the progression of gum disease in ways that aren't always obvious. First, there's cumulative damage. The bone loss and tissue recession that develops over decades of suboptimal oral hygiene doesn't plateau, it compounds. Small amounts of yearly recession add up. By the time someone reaches their 50s or 60s, what might have been a manageable early-stage issue in their 30s has often progressed to something far more complex. Second, there's medication. A significant percentage of adults over 50 take medications that list dry mouth, xerostomia, as a side effect. This includes antihypertensives, antidepressants, antihistamines, diuretics, and many others. Saliva is not optional. It's a critical part of the mouth's natural defense system. Reduced saliva means reduced protection against bacterial overgrowth, reduced acid buffering, and increased risk of both decay and gum disease. Third, there are hormonal changes. In postmenopausal women, the drop in estrogen levels has been associated with decreased bone density throughout the body, including the alveolar bone that supports the teeth. Research has shown higher rates of tooth loss among postmenopausal women with osteoporosis, partly due to this systemic reduction in bone density. This is an underappreciated connection that deserves far more attention. Fourth, there's systemic disease. Conditions more prevalent in older adults: diabetes, cardiovascular disease, chronic kidney disease, autoimmune conditions, all have documented relationships with periodontal health. Diabetes, in particular, has a bidirectional relationship with gum disease. Poor blood sugar control makes periodontal disease worse, and active periodontal inflammation makes blood sugar harder to control. Managing one without addressing the other is like bailing out a boat without plugging the hole. None of this is meant to be discouraging. I share it because knowledge is protection. Understanding why the risk increases after 50 means you can respond intelligently. It means you prioritize dental checkups rather than skipping them. It means you communicate with your physician about dry mouth as a side effect and explore solutions. It means you connect the dots between your overall health and what's happening in your mouth, rather than treating them as entirely separate concerns, because they are not separate. Part 7. The connection nobody talks about. Your mouth and the rest of your body. This is perhaps the part that surprised me most in this entire investigation. The connection between oral health and systemic health goes much deeper than most people know, and much deeper than what gets communicated in routine dental visits. The mouth is the gateway to the body. Literally, every breath you take, every bite of food, every sip of water, it passes through that oral environment first, and when that environment is out of balance, when pathogenic bacteria are thriving in periodontal pockets and inflammatory signals are coursing through the gum tissue, the effects don't stay local. Bacteria from the mouth can enter the bloodstream through compromised gum tissue, particularly during activities like brushing, flossing, or chewing. For most healthy people, the immune system manages this without incident. But in people with compromised immunity, or with certain heart conditions, this bacterial translocation can have real consequences. Researchers have found correlations between periodontal disease and cardiovascular disease, with some studies suggesting that individuals with severe gum disease have a significantly higher risk of heart disease and stroke. The proposed mechanisms involve both direct bacterial effects and indirect inflammatory pathways. The chronic low-grade inflammation of active gum disease contributes to systemic inflammatory burden, which is itself a known risk factor for cardiovascular events. There's also compelling research linking periodontal disease to respiratory conditions, particularly pneumonia in elderly patients where oral bacteria are aspirated into the lungs. To Alzheimer's disease, where periodontal bacteria have been found in the brain tissue of affected individuals. To adverse pregnancy outcomes where active periodontal infection has been associated with preterm birth and low birth weight. I want to be clear, correlation is not causation, and this is an active area of research where certainty is still developing. But the accumulating body of evidence is significant enough that the World Health Organization and numerous public health bodies around the world have called for oral health to be integrated into general healthcare frameworks, not treated as a separate, lesser concern. Your mouth is not isolated from the rest of you. What happens in your gums is happening in the context of your whole body, and taking your oral health seriously is, in every sense, an act of care for your overall well-being. Part 8. Building the routine that actually works. So let's get practical, because everything we've covered leads to one place. What do you actually do about it? Morning routine. Before eating anything, brush your teeth using the modified base technique. Soft brush, 45-degree angle to the gum line, light pressure, small circular or vibrating motions, a full 2 minutes minimum. Start with the areas you usually rush through. The insides of the lower front teeth, the backs of the upper molars, the gum line across every quadrant. After brushing, use an alcohol-free mouthwash if desired. Alcohol-based rinses can dry out the oral tissues and disrupt the microbiome, so the alcohol-free versions are generally preferable for daily use. Evening routine. This is the most important cleaning of the day, because bacteria work while you sleep. Saliva production drops significantly overnight, removing one of your primary natural defenses. Whatever bacterial buildup is present at the end of your day has 8 uninterrupted hours to do its damage. Start with flossing. Clean every interproximal surface using the C-curve technique described earlier. Then brush. Then, if your dentist has recommended it, apply any additional therapeutic agents. Consider adding a tongue scraper to your evening routine. The tongue harbors a substantial portion of the mouth's bacterial load, particularly toward the back, and scraping it each evening can meaningfully reduce overall bacterial counts and directly address the persistent bad breath we talked about earlier. Weekly check-in. Once a week, look at your gums in the mirror in good light. Not to obsess, just to check in. Are they pink and firm? Are there any areas that look red, puffy, or darker than usual? Has any visible recession occurred since last you looked? Are there spots that feel tender when you press gently? This kind of regular self-monitoring ensures that any changes get noticed early rather than after months of silent progression. Professional care. For most adults, professional cleanings every 6 months are the standard recommendation. But for individuals with active gum disease or a history of periodontitis, every 3 to 4 months may be more appropriate. Your dentist or periodontist can advise based on your specific situation. Do not skip these appointments because nothing hurts. Pain is not the standard for whether your gums need attention. Part 9. Nutritional support for gum health. This piece of the puzzle is the one that most people never think about, because we're so conditioned to think of gum health in purely mechanical terms that we forget the gum tissue itself is a living biological structure that requires nutritional support. Vitamin C is the most well-documented nutrient for gum health. It's essential for collagen synthesis, and collagen is the primary structural protein of gum tissue. Even moderate insufficiency in vitamin C can impair tissue repair and slow healing. Citrus fruits, bell peppers, kiwi, and strawberries are excellent sources. Vitamin D and calcium work together to maintain bone density, including the alveolar bone that supports the teeth. Ensuring adequate vitamin D, particularly for individuals over 50, who often have reduced conversion efficiency from sunlight, is directly relevant to periodontal health. Omega-3 fatty acids have shown anti-inflammatory effects in several clinical studies focused on periodontal disease. Increasing fatty fish, walnuts, and flaxseed in your diet may support the body's ability to manage and resolve gum inflammation. On the other side, limiting sugar and refined carbohydrates directly reduces the fuel available to pathogenic bacteria. This isn't general health advice, it's targeted strategy. Bacteria ferment simple sugars into acids. Those acids shift the oral pH in ways that favor pathogenic species over beneficial ones. Every sugary snack you eliminate is a vote in favor of your microbiome balance. Part 10. The moment that changes everything. I've covered a lot of ground in this investigation. We've talked about the silent signals, bad breath, bleeding, sensitivity, and what they actually mean beneath the surface. We've talked about the brushing mistakes that millions of people make every day without realizing the damage they're slowly accumulating. We've walked through the stages of progression from fully reversible gingivitis to irreversible periodontitis. We've explored the microbiome perspective, the systemic connections, the age-related risk factors, and the nutritional support that most people never think to apply in this context. And I want to end with the one thing that matters most. None of this information is useful unless it changes something you do. Knowledge sitting in the background, acknowledged but not acted on, is just comfortable rationalization. It's the mental version of seeing the bleed and wiping it away. The moment that actually changes your gum health is not the moment you learn something new. It's the moment you decide that this matters enough to act on. Right now. Not after the next dental appointment. Not when the sensitivity gets bad enough to push you. Not when your dentist finally shows you something in the mirror that you can no longer dismiss. Now. Because here's what I've learned through all of this research. The people who successfully reverse early gum disease, who stop the recession, who restore the health of their tissue, and go on to keep their natural teeth for life, they all have one thing in common. They didn't wait until it was dramatic. They acted on the subtle signs. The early signs, the ones that were easy to dismiss, but that they chose to take seriously instead. You've been reading this for a reason. Maybe something here resonated with your own experience. Maybe you recognize your own gums in one of these descriptions. Maybe you've been noticing something you've been quietly trying to ignore. That recognition is a signal, and signals exist to be acted on. We've left a practical guide in the first link in the description. Click and take a look. It walks you through exactly how to correct the invisible errors that most people make every single day without realizing it. Technique, routine, the specific methods that the evidence supports for interrupting the progression and beginning to restore gum health. Because yes, there is a solution, and it doesn't come in a miracle bottle. It comes from the right knowledge, applied correctly and consistently. If your gums are already showing signs of recession, if the bad breath has become persistent, if the inflammation has been going on longer than you'd like to admit, then you need to go further. You need to act with intention. That's why I'm recommending the guide one more time. It's there to give you a clear, concrete, step-by-step path forward. Subscribe to the channel, because in the coming videos I'll continue guiding you through this journey, bringing you information that can literally change the way you care for your oral health. Because at the end of all of this, it's not just about teeth. It's about your voice, your confidence, your ability to eat the foods you love, to smile without hesitation, to speak without self-consciousness. It's about the years of your life in which you get to do all of those things comfortably, freely, and without regrets. And that begins now.